All right. Very good, guys. Welcome, welcome. Good morning. All right. So today we're going to talk about this very important topic, falls in Parkinson's disease. All right. So that's something we deal with on a regular basis, with our patients, like to prevent them and also afterwards. Unfortunately, sometimes we have good situations that patients have been falling but no injuries, but sometimes on the other side we have some injuries, and then we have to work with that as well regarding the therapy. Our main topic today is just to raise that awareness regarding the falls, all right, and what we can do to avoid them, and be a little bit more cautious. All right. So if you don't know me, I'm Dr. Lenny Carneiro, physical therapist from Dr. Physiotherapy and Wellness. And also we're going to have as a guest today, our dear occupational therapist, Moses dos Santos, who's going to also be one of our speakers of the topic today. Okay. All right. What's the learning objects here? Okay. So our goal is to acknowledge the impact of falls in people with Parkinson's disease, because they are real and they happen, okay? And understand the effects of PD symptoms on increasing the risk of falls, identify contributing factors to those falls, and also learning and act on how to prevent those falls, okay? All right, let's start. Facts of falls in Parkinson's disease. Let me just see if I can minimize my right here so I don't get distracted and also can see the whole picture, the whole slide. All right. So in 1917, when James Parkinson wrote his essay on Parkinson's disease, he stated, all right, so the patient on proceeding only a very few paces would inevitably fall. And also, like why aging may put all of us at risk, of falling. People living with Parkinson's, they have almost twice, of the risk of their peers, actually have twice the risk of their peers. And then falls are a significant cause of disability, loss of independence, reduced quality of life in people with Parkinson's disease. So that's why the topic is so important, because we don't want that to accelerate, problems around those falls, and then between 45% to and 68%, people with Parkinson's disease will fall each year, with a large proportion of recurrent falls. As you see, it's a big number. It's a big percentage, big amount of, a great amount of people falling, and then even higher with recurrent falls. That's why those things, this topic is so important, because we know what can happen: disability, loss of independence, and reduced quality of life. One of the most important cause of morbidity and even mortality, it is those falls. So that's why we always get concerns about it, because we have more serious issues about it. So that's why we have to be a little bit a little bit more cautious about it, because it could create those things, and we don't want it, especially when we can avoid them. Okay. And recurrent falls often cause traumatic consequences and shorten the duration of the PD in patients by 7 years. Isn't it, remarkable that a fall can shorten the duration of lifespan in 7 years? We don't want that to happen. If we can live 7 years more and avoid those falls, why not? I bet everybody, is on the same page regarding, live longer, make memories, stay with your loved ones as long as you can. All right. And the risk of falls and fractures rise steadily from 40 years of age, much earlier than in a healthy individuals. So people, if you compare peers, from 40 years old, mostly, young onset, can have those falls. All right. And so it's just like, once you have Parkinson's, the falls, could start earlier than, somebody without it. All right. The consequence of falls are devastating and included restriction of activities of daily living, which Moses is going to talk about it. Fear of falling. Once you fall once or twice, the fear of falling increased significantly. That's something that we have to put in context. That's why the therapy comes to kind of like, build up that confidence again. And of course, consequently, because of those falls, high levels of caregiver stress and injuries. All right. So we can call that fractures, especially on hips, vertebrae, shoulders, concussions, especially when you hit your head, and we don't want that to happen. The incidence of hip fracture is 4 times that for older people with the same age without Parkinson's disease. So getting somebody let's create a scenario here, 70 years old, no Parkinson's, with a person with Parkinson's, same age, that person with Parkinson's has 4 times risk of hip fractures. And once you have that, your mobility will change. You're not going to be able to walk for a long time, and other issues might pile up. Okay, and this has significant economic consequences, as the costs of fall-related fractures in people with Parkinson's are close to double those in older people. So just to manage, a hip fracture, there's just the treatment involved, sometimes surgery, those things, the costs around it, it's double when you have Parkinson's. Okay, because we have put in consideration that other things will come up as related to Parkinson's as well. Let's talk about the contributing factors of those falls. We're going to talk about 2 main important ones. What is called intrinsic factors, which is related to 70% of those falls. And then extrinsic factors, which Moses will endorse that as well. Okay? Which ones are those intrinsic factors? Anything that happens in your body related to your health, inside of you, that kind of thing is related to that. All right. If you have some sort of rigidity, stiffness, you're moving slow, has some balance problems, you don't feel like, you're wobbly off a little bit, and also have some freezing, shuffling, dyskinesia, which is more like, a dance-like involuntary movements, and muscle weakness. Those things enhance the risk of falls. So they are motor. So those things, we see it, or it's more visible. Okay, it's easy to pick through a skilled eye. All right, and then we have non-motor symptoms. For people, they have some autonomic problems, and then they can create this kind of like orthostatic hypotension. When you stand up, you can have a drop of a blood pressure, and some people can faint, or feel like lightheaded just because of the drop, and that could cause a fall. Fatigue, that something happens quite often with Parkinson's patients, and then once you're more fatigued, your alertness and also the quality of movements are not there, that enhance the risk of falls. Constipation, all right, dehydration, some cognitive change, urinary incontinence. Sometimes you just trying to rush, to the bathroom, and then, you might not have enough time to accomplish that, even though it's a short distance, because of the incontinence, and then that could create a fall. And also visual hallucinations, which is not related to a physical visual impairment. It's just like perhaps related to side effects of medication. You see things that's not there, but we also have people who have some vision problems related to Parkinson's, so such as double vision, blurry vision, and also change in depth perception, like the measurement of a depth, how far things are is not there. Okay, the accuracy of that, and that can create, some problems. Like you want to reach, you think, it's kind of this distance, but it's kind of further away, and then that create like a tripping episode. And also comorbidities. People can experience vertigo, and that also can create some falls. And neuropathy. What's neuropathy? Is the lack of feeling in your legs, and that could also be related, create some issues, because you don't feel much your legs when you walk, when you're stepping, and then that can create some sort of like problems with the steps, okay, and then falls. All right, now I'm gonna pass, the slide for Moses. Moses, all yours. If you can unmute yourself and go ahead, my friend.
I'm unmuted. Hey everyone, sorry I'm a little late. I was on my way back from a home visit. 1 second. All right. So the extrinsic factors, to just go off what Lenny's been talking about. All the factors is, the first one is the uneven surfaces. A lot of falls occur when a lot of people are out in the community, even within their home. Uneven surfaces can also be if you're walking within your home and your living room, you have to take a step up to or down to another room. So a lot of falls can happen with that, as you know, with Parkinson's. With the freezing, a lot of freezing happens before taking steps on uneven surfaces, which can affect the trajectory of your swing, which is when your foot is coming forward, and it can cause you to trip. Slippery surfaces, very important to be aware of when the floor can be wet. So if you have someone who does any housekeeping, to let them know, to let when they're mopping, to stay away from that area of the house. If necessary, to getting signs to put throughout the house. It might sound a little ridiculous, but I've had clients use that, and it's helped them tremendously to avoid falling. Obstacles, avoiding all clutter. You guys need as much room as possible. The more clutter there is, the more freezing happens, which causes you to fall forward. Poor lighting, not being able to see where you're going. Make sure, even when you go out to a restaurant, let's say, and they want to sit you in the back where there's almost no lighting, or if you're in a restaurant that overall has very little lighting, ask to be seated by the bar section that usually has a lot of lighting, and they have tables. Just always focus on walking in areas that have adequate lighting. Proper footwear. The best thing to wear are shoes when you're walking. I'm from the north. I like wearing flip-flops when I'm here in Florida, obviously, but shoes is the way to go. Also, it helps you in recovering from a fall, meaning if you trip and you have a loss of balance, utilizing those footing reactions in order.
Oh, sorry.
What happened?
Hold
Oh,
on.
Lenny, I'm not that fast, Lenny.
I know. Sorry.
There we go. Okay. So yeah, proper footwear, always wearing shoes, because there's moments where, and I've worked on this with clients, where there'll be a loss of balance. So we work on footing reactions, meaning if they fall towards the right, be able to bring that right foot out. If you're wearing flip-flops or sandals, it can get caught under, and it can make the fall even worse. And the worst case scenario in that is falling, and on top of that, rolling your ankle in the process, which happens a lot if you're wearing sandals or flip-flops. And last but not least, the assistive devices. which is pretty much, your cane, your walker, rolling walkers, the four-wheeled walkers, knowing which one to use for certain scenarios. I have clients who will use their cane at home, but if they go out in the community due to the uneven surfaces, the increase in uneven surfaces, I usually recommend a rolling walker for those scenarios. So, um, the
I'm
next
doing,
one, sorry.
yes, you. Can you see that? Next slide. I'm doing that.
Is it Oh yeah, the extrinsic factors. Yeah. The medication effects. It's very important to be aware effects of what medications can do to you. A lot of times, we'll have clients both in PT and OT who will say, I woke up today feeling lightheaded or dizzy, and we have to remind them, you're on medications that causes that. So that leads to training in pursed lip breathing, which is a form of breathing to prevent feeling lightheaded. A lot of falls happen when clients when people get up from sit to stand too quickly or jump right out of bed. A lot of times I tell people, sit at the edge of the bed, do a little breathing, drink a little water, and then get up. And even so, when you get up, take like a few seconds. Don't just get up and just get moving. Get up, see where your feet are, wide base support. I don't feel lightheaded, and then go about your task. A lack of grab bars or handrails. This,
Moses,
yes, sir.
mind if I interrupt you? Just make a parenthesis here,
Yeah,
especially for those, at home. Like in a clinic, we check the blood pressure of our patients very, very often, because we want to know if there's any dizziness or lightheadedness related to low blood pressure with the hypotension or even with orthostatic hypotension. However, if you're not accessing now, any service with the therapy or the therapists that you work with are not check your blood pressure, do it at home, in a regular basis, especially because if you're feeling a little bit lightheaded, and dizziness is part of it, because that's very important, to address that with your doctor. Okay, so we do that to know how safe it's for us to work out and exercise, those things. On top of that, to know if the blood pressure has been steady, right? But also, as a homework, you should be able to keep track of it, and that it's an issue to you. Don't wait, until a fall happens, so then you can be related, to that and try to act. Try to be a little bit more upfront. Be a little bit more proactive in a way that you can check on a daily basis at home, and then you can bring that to the doctors if it's needed.
absolutely. Yeah, being aware of even the range where your blood pressure is too, to go off what Lenny just said, is very important. Sometimes it might be at the high end of the range, and clients say, "Oh no, that's okay, that's my range." So it's very important to being aware of the range of your healthy blood pressure, and when too low is too bad, and too high is too bad for you also. Um, Another thing is the lack of grab bars or handrails. This goes especially with bathrooms and staircases, especially in bathrooms. Bathrooms, I always say the more grab bars, the better. I've had clients who have grab bars throughout their entire home in order to help them, get up from a fall, for fall recovery. So it's very important also knowing how to use them. The changes in your environment, being very familiar with these changes in your environment, not just have someone come in, this is for your own home. If someone does like a home renovation and not reviewing that, if let's say you do have a therapist who goes to your house, or even if you go to the clinic, it's important to let them know, hey, I just had, my bathroom renovated. Do you mind coming to my house to just making sure I have everything in order? That's a very big thing. A lot of times, I'll have patients who have not had any falls. They get a home renovation, they don't tell me, or they don't let the physical therapist know, and they have a fall, and you're like, wait, what was different? Oh, I had, my bathroom redone. Oh, well, you should have mentioned that to me. So it's very important to be familiar with your environment. And then to go off that, especially with traveling or visiting family. to know what you're dealing with when you get there. You know, when you make a reservation, I know everything's online now, but if you can make the reservation online, but then call the hotel, the resort, and just, it's their job to review with you how the rooms look like. If it's handicap accessible, or let's say it's somewhat accessible, to know the layout. Specifically, you want a place where the bed is against the wall, so you have as much floor space as possible to work with, which also goes hand in hand with the spatial awareness. The more space, the better your awareness will be. The more clutter you have in an environment, the more difficult it is to utilize your spatial awareness. Also, to go off that is the distractions. You know, depending where you go, it could be very loud. Going back to the whole to the restaurant, the adequate lighting. Sometimes you might want to go to a part of the restaurant that's not as loud. That can disrupt your concentration. Sometimes when high stressful situations increases your chances of freezing, and the chances of you not properly utilizing the body mechanics because you're not focusing the right way. And God forbid, if you're alone, you're not going to have someone next to you to cue you on that, and can also increase your risk of falling.
All right. Now I'm gonna talk about this here in regards, when the falls are more noticeable. Okay. As you guys might know, like the diagnosis comes with some sort of, is done clinically by symptoms. So the doctor see you, and based what you bring as symptoms, you put the dots together, and then we have this a scale. It's called a Honiard scale to know which stage the Parkinson's patients are. All right. So stage 1 is just one side, perhaps tremors one side, or just not moving properly with the arm swing. It's kind of a weakness on one side. And then stage 2 goes both ways, maybe the tremors, both sides, and then, some lack of arm swings, bilaterally, some weakness in both arms, legs, those things. On a stage 3, it's when we know, their falls are more prominent. We know the falls can happen in any stage, all right? So I want you to be aware of that, all right? But as the disease progresses, it's more evident on stage 3 and on. If you don't do anything with it, if you don't act, try to prevent it, from that stage and on, it's when like we can create some more burden, on your end in regards what the falls can happen, and bring it to you. So that's why it's so important to understand, like, about that, because it can happen in time, but people who is already on stage 3 that has been more problems, like falling a little bit more, like maybe just not like the real fall or like a bad fall, but some tripping, some losing, the balance here and there. And that's when, we should act quickly to avoid that. Okay. And then who is more in risk of falls? Okay. So there's different ways to categorize, Parkinson's. One of them, it's by symptoms. And then we can, create these categories, 4 categories based on symptoms. The first one is the tremor predominant. If your Parkinson's, you start with more the tremors, the tremor dominant is the category or the subtype that will progress slower and have more, like the symptoms will come up later. Okay, for the symptoms. All right, so we have more lifespan, I would say, with the disease. The bradykinesia is the one, like bradykinesia, when you move slow, it's not much the tremors, but the quality of your movements has changed, your posture has changed, and then you're moving slower, shorter, and smaller. Okay, this kind of subtype category, you increase the risk of falls. All right, with that type. Why? Because can you imagine yourself, like if you move slow and stepping slower, when you require perhaps to move out of that pattern that the Parkinson is telling you to behave and move, and then it's when the problems starts. So that's why the bradykinesia can be, can create some risk of falls. However, the postural instability and gait difficulty, it's called PID, GD, is the most challenging one in related to the falls, in more risk of falls, because those are the ones that are developed more freezing, more shuffling, okay, and those are the ones that will experience perhaps falls more often, all right, most related to those episodes, okay, of shuffling, freezing, getting stuck on the floor, feel like their legs are pretty heavy, and they're not moving properly. And those people who has this kind of subtype, when we do a little bit more thorough assessment, they present other issues, which translates why the fall is happening as well, because they are weaker, so there's some cognitive change, and also the posture, reaction is not there. So that's why those problems are more evident with this kind of subtype. And then we have those that have, the subtype with the REM, rapid eye movement and sleep behavior disorder, are those that has been acting quite often during their sleep. Perhaps they kick, they hit their spouse, those things. Those are the ones that also can have falls, but from where? From bed. I have perhaps 2 weeks ago a patient that reported that to me. He had a fall. He had a vivid dream. That he was driving a car, and the car was doing something like a weird movement, blah blah blah, and he was trying to avoid it, and that brisk movement got him out of the bed. So luckily he was fine, but he hit his head on the floor, and those cases, falls are also proeminent. Okay. And also the direction of the falls give us cueing, what to do and how to prevent them, what's the mechanism, what's causing the falls, and what to do to avoid them, So that's why it's a predictor of the mechanisms that for us as a therapist to really, be on top of that and help you to prevent them, okay? If you're falling forward, probably that might be related to the freezing. The foot's getting, stuck on the floor, you kind of shuffling a little bit, or still wants to move, but it's hard. And then if you're using perhaps, you try to kind of lean forward, try to compensate, and that doesn't happen. It's that when, the falls happen. And sometimes people have those freezes episodes even with the walker, which create more issues, because the walker keeps going in front of them, they lean more, and those falls are really accurate with those scenarios, all right? If you're falling backwards or sideways, might be related to balancing impairment, some sort of akinetic rigidity, or I would say, bradykinesia, or, rigidity, stiffness in your trunk, and you lose, especially related to balance impairment, that's what is called retroposition. When you go backwards, you lose your ability to react, quickly and properly, and then boom, you went backwards, So the doctors usually do that test with you. You might have experience when they go behind you and pull you back, and then you have to react. That's why they're testing if you have that kind of reaction with the retroposition. All right. And then maybe neuropsychiatric symptoms is related to that. All right. Forward fallers tended to fall mostly during walking or turning. Okay, mostly when they are doing some sort of movement, or are willing to do some movement, right? Non-forward followers, those that are falling backwards or sideways, mainly fell during walking, sitting, or standing. Not necessarily they are moving, but perhaps, even sitting, they can go backwards. There's no reaction, or standing. They stand up and then balance is not there, and then they can go backwards. All right. So it just makes sure that's something like when you standing or even seated, if you're having issues to kind of like, recuperate your posture from leaning backwards, you should have something always, behind you, especially with the seating, like, back support or standing, somebody guiding you and prevent you to fall backwards. Okay. And then non-forward fallers had more frequent mild falls and less moderate falls compared with forward fallers. All right. Go ahead, Moses.
Okay, so fall prevention strategies. So just like Lenny showed in the previous slide, and he showed a lot of statistics with falling forward and falling backwards. It's very important to know how the falls occur in order to prevent these falls from occurring. So as I stated before, one thing that is worked on a lot is footing reaction. So when you do have a loss of balance, knowing how to bring that foot out to not only stop the fall, but maybe even break the fall. A lot of people have told me that they had no idea how serious forward falling was. A lot of people think you fall forward, you have your hands, you can stop it. And a lot of people are much more afraid of falling backwards rather than falling forward. And as you saw on the previous slide, it is the complete opposite. As we know with Parkinson's, your reactions are slowed down. So you're not going to be able to bring that hand forward to stop it. Um, the approach is usually starting off with medication management, is knowing how does a medication make me feel, so knowing, okay, this medication can cause me to be lightheaded, meaning when I change positions I can be lightheaded. So going back to getting out of bed and getting up right away, you can get a little dizzy. Now falling backwards, you'll be fine, your bed's right behind you. But if you go forward, you don't know what can be in front of you. God forbid you have a dresser in front of you and you can hit it pretty hard, and you're not going to have enough time to react to it. The physical and occupational therapy, probably the best approach in regards to preventing these falls, is being very specific with your therapist on how you fall, when you fall, so they can prepare you for it. So when you're doing your exercises, they're doing it specific to that. Okay, feel free to ask to share in detail. You can even spend minutes, maybe even up to half the session, just explaining where you fall. Let's say you fall in a different way in every room. Feel free to let your therapist know. What we work on is client-centered practice. So do not be afraid of asking questions and just informing us on how you're falling. We can't help you if we don't know what you're dealing with at home, especially if you come to the clinic to work with us and we're not in your home. When we're in your home, we can kind of figure things out. Let's say we're walking around your house and we say, hey, your pan is right across the kitchen from your oven. How do you get the pan all the way to your oven if you're cooking? And then oh yeah, I usually trip when I'm on my way to the oven. So okay, that's something we need to work on. And then we can help you with that approach. Knowing what assistive devices to use. I can't tell you.
Moses, let me make a comment here.
Yes, sir.
And try not to hide, from your
Yes. Yes. We will find out.
right. Sometimes, uh, 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 people get bruises. Sometimes they don't, but it's important for us to know, when those falls happen, because we're not going to expect for another fall, and then try to react. No, we should act intentionally to prevent those, and that's why we ask what happened, what can be done. And sometimes we even call the doctor if it's needed, to help you. We'll do it. So remember, we are on your side, but sometimes people try to hide it. Oh, I don't want my wife to know it. I had a fall, or please don't tell my kids. I get it. I'm on your side, but just be cautious of that. We don't want to create more issues related, to those falls. So that's why we have to be a little bit more conservative and cautious with our approach, and with the physical therapy and occupational therapy, those approaches will help you to build up your balance, or help you, with the strategies to avoid them, or even, for example, for home visits, when you go to the patient's house, we can kind of like help you, which Mo is going to talk about it later. Things that can be done to adjust it and prevent those falls to happen, to maximize your space and your safety at home.
Yes, the idea, as Lenny's saying, is we want to be proactive, not reactive. Sometimes when we're reactive, it's, we don't know what injury you can have, and not every time you fall is gonna be the same. A lot of people get lucky with how they fall. Can't tell you how many times I've had clients say, "Oh, I forgot to put on," just an example, my pants sitting down. I did it, and then they fell forward. Unfortunately, the bed was in front of them. But God forbid they're at their kid's house or at a friend's house, and they don't have the bed in front of them. So it's very important for us to know when these falls are occurring and be as detailed as you can. Don't think, oh, I'm gonna get in trouble. No, you're not. Like Lenny said, we are on your side. The home environmental modifications, I know, I can't tell how many patients I've had that, but I like having my furniture there, but then it's like, okay, how much do you like falling? That's always a comparison that I give in order to make those modifications, in order to prevent and be proactive. Not, I've had patients even tell me, oh, but it hasn't happened. It's like, we don't want it to happen, so we
Right.
want to avoid it before we have to be proactive. All right. And also regularly exercising, always moving. If you're not moving, your body doesn't become familiar with movement. Hence why freezing can increase. You're utilizing your body mechanics never it's solved because you're not working on it. We want to establish that connection with your brain and your muscles, which, as we know with Parkinson's, that's the big disconnect that occurs, and which leads to a lot of falls when you're not moving. It's great if you come 2-3 days a week to therapy, but if afterwards all you do is go home and just sit down and watch TV, we're not really getting a lot of progress made.
Absolutely. And also, I just want to illustrate one situation that I have here in a clinic recently, which happens quite often. A lady came and she has Parkinson's, and she came with a cane, walking. And all those her scores, like when we do to see her balance, strength, and those things, her overall functional mobility, her scores were not good at all. So, and then I just present to her, like, the scenarios like this, explain, and then make that suggestion. All right, let's go and now not use the cane and try to use the walker now. And I give that, the behind the scenes why, until we improve her strength and her balance, and see if she's able to still safely operate with the cane. But no, we just change the plan, because safety is first, as priority. And then, as occupational therapists, Moses will tell that as well. They will guide you regarding other device to do at home to facilitate your space, how you how you maximize your activities, if anything it's needed. So that's why occupational and physical therapy is so important, because you can bring the issues that we experience for us, and then we can kind of like brainstorm and see what's feasible for you or not.
Absolutely.
All right, so this one, I'm just gonna, bring back for the slides that we had, regarding the intrinsic factors. What's the strategies, which we're gonna talk about later, more specific. Medication management, talk with docs about it, physical therapy, occupational therapy, start that as soon as possible, especially for the assessment, and see if you require that skill therapy. Use of assist device, which one will fit better for you, and also the regular the exercise regime, as Moses mentioned. Okay, and also the contributing factors, which he talked about it. Same thing. make some home and environmental modifications, which we're going to talk about now, assisted device, and medication review. Go ahead, Moses.
All right. So, to go back to what I mentioned earlier, but now I will go over it in more detail, um, is the home modifications. This tends to be a pretty tough part of the job. Um, is a lot of people love how they design their homes. I think that's a big thing of having to change their homes. I myself have a mother who is obsessed with how she places everything, and change isn't easy. Obviously, when it was something that you imagined in your mind, and then you finally put it out in your dream home. But again, we have to prioritize safety over everything. All right. So, as I mentioned before, the first and foremost is minimizing the clutter. Okay. If you have a lot of clutter, you will increase the freezing and fall forward. So, minimize as much as you can and try to increase the spatial awareness, meaning more floor space, more room to work with. That means if you do have a loss of balance, you could utilize those footing reactions that I've been mentioning without hitting something. A lot of times people, I'll say, why didn't you step to the right? Why didn't you step forward? Oh, well, I couldn't. I had a coffee table there. I had this there, or I had, or the hardest one is, oh, I had an ornament there. That's why we have to minimize the clutter. We have to, as I like to say, we have to leave room for error because there will be errors. The thing is, there's levels to errors. There's a fall, that's the error we don't want, but then there's an error of loss of balance, but being able to catch yourself. So we always have to leave room for error. Another thing is removing rugs, arranging power codes, and adding night lights. A big thing that causes loss of balance also is tripping. Okay. As much as you might love that rug can become your worst enemy if you have Parkinson's. We got to get rid of throw rugs are your number one enemy when it comes to fall risk. Also, power cords. Nowadays, we all have smartphones, meaning we all want to charge, we all want to have a charger nearby. I've been in homes where clients have grandkids, and for the grandkids, they'll buy extra chargers. So there's more chargers available for the grandkids. And I tell them put the chargers away until the grandkids are in town because you don't want to trip over these power cords. Okay. Nowadays, also, in case you guys don't know, there's a lot of companies that offer, for example, for TVs. I know, we're very used to seeing, the cords coming out of the back of the TV. There's a lot of companies now that offer to organize your cords and put them all in one place so they're not dragging all over the place. So that's something that's available. That's something that as therapists we can provide you with that too, and advise that. And then lastly, the night lights are big. As we know, the incontinence is a big thing in Parkinson's. People waking up in the middle of the night to have to go to the bathroom. It's important to know where you're going. I've had clients say, oh, but I know my home. Now, when you're half asleep and you're on medication, it's important to have these night lights available to actually guide you to where you have to go safely. You do not want to fall in the middle of the night. God forbid if you have a partner or a caregiver who's a deep sleeper or a caregiver that just isn't paying attention and you have a fall and you're lying there for quite some time. Next is making your bathroom and toilet area safer by adding grab bars and mats with grip. A lot of falls, especially for OT that I hear about, are in the bathroom. A lot of times people will get a walk-in shower installed and think, oh, well, I don't need grab bars. I just step right in. Yeah, but it could be wet. Could be wet. You can be having a really bad day. And if you freeze and go forward, there's nothing better than to have a grab bar where you can actually hold on to in case that were to happen. Furthermore, to go into the grab bars, believe it or not, that's something we have to review in using. A lot of people misuse their grab bars, or when they enter the shower, they grab the wrong grab bar, therefore utilizing more energy. And then by the time they get in the position to shower, they're drained and they can't shower efficiently. And then by the time they get out of the shower, they're so fatigued that they don't know how to use the grab bars. They're going to use it wrong again, therefore increasing the risk of falling. And then mats with grip are very important. I have a client who has mats with grip from the moment you step in his bathroom all the way to his shower, just to be safe. So I had to tell him to get rid of some of them, but then again, you want those mats with grip just in case there's any freezing, and for you to reestablish yourself and regain proper posture and a wide base support. And lastly, with home modifications, is place everything you need for certain tasks in the same area to conserve energy and avoid walking back and forth. This is going back to what I mentioned about the kitchen. You don't want to, if you love cooking, you don't want to have your stove here and then your pots and pans, condiments, ingredients on the other side of the kitchen. You want to minimize as much moving as possible. Number one thing in regards to doing your daily activities is energy conservation. A lot of falls happen, excuse me, when people are fatigued and they're not aware of how fatigued they are.
Absolutely. I just want to mention one thing here. So your towel hanger is not your grab bar. So
Yes. Thank you for mentioning that.
please don't substitute that. I have patience really like relying on it and ripping that wall off, totally, because they just lost the balance and boom, once you use it, that's it, right? And also your grab bar, if you need something that you need to pull up, you have to pull yourself up, you need a little bit more structure, behind, to kind of like, if that's your case. If you just need for like, to hold on it, it's one thing, but you have some, if you need something to help yourself to pull yourself up, then perhaps you might need to have like, somebody that knows what you're doing and what's the need, what's your need to kind of like really work on it, especially with those handmans, and like they can work on those things and make it feasible for you.
Absolutely. Okay. Environmental modification. So, this goes hand in hand with home, but when I mention environmental, I'm also referring to the community, meaning, going on vacation, staying in a resort, staying at a friend's house, going out to a restaurant. Whenever you're visiting anyone or at a resort, making sure that you're marking parking spots for your assistive devices and your adaptive equipment. Assistive devices are your walkers, your canes, and adaptive equipment are your reachers. If you guys aren't familiar, a socket helps you put on your sock. It's important to know where all these things are. Okay, let's say you're on vacation and your partner or whoever you're on vacation with thinks, oh yeah, I'm just gonna go for a walk. They know how to get dressed. Um, okay, that's fine as long as everything is where they know where it is. Everything has to be organized. Okay, whenever you're in a place where you're not familiar, that increases your symptoms. Okay, it's stressful. You don't have that the comfort that you have at home. As we all know, whenever we spend the night somewhere that we're not familiar, we don't sleep as good. I'm sure we can all relate to that. So it's the same thing in regards to knowing where your devices are, where they might have put them. Let's say you wake up and they're nowhere to be found. You're like, oh, well, I want to go and get breakfast. Where's my socket? And let's say your socket is in one end of the room and your reacher's on the opposite end of the room. That's more energy you're going to have to use to get your equipment. And again, you're in a place that you're not familiar with. So we got to add that stress factor. Going back to the adequate lighting, making sure when you go to these restaurants or any place for a social event, make sure there's enough lighting where you can see where you're going, making sure you're not tripping over a power cord or a throw rug, avoiding throw rugs if possible, with the adequate lighting. Assuring furniture is against the wall for increased floor space. Again, spatial awareness is something that's affected with Parkinson's. You want as much room as possible. Use those footing reactions and break those falls and prevent a loss of balance from resulting into a fall. And then, of course, avoiding uneven surfaces. Okay, if there's an alternate route, take the alternate route where there's an even surface versus where there's an uneven surface. And always be aware and take your time. All right. Next is avoiding falls during activities of daily living. So, this is what OTs mainly focus on is ADLs, also known as activities of daily living. Uh, just a quick overview on these. This is related to getting dressed, um feeding yourself, oral hygiene and grooming, bathing, and going to the bathroom with toileting. All right. So a lot of falls happen during these activities. Okay, a lot, and it can be with anything. Obviously, with self feeding, most of us are sitting down when we're eating, hopefully. But then with all the other activities, prior to your diagnosis, I'm sure you do plenty of them standing. Now, one thing I do as an OT is I like to keep you guys as independent as possible. Okay. So if you like to brush your teeth while standing in right in front of the mirror, that's fine. The main thing about that is making sure everything you need is within functional reach from where you stand in front of the sink. Okay, not having you flossing your teeth, and in the middle of flossing your teeth, your toothbrush is 10 feet away from you. What happens with that is you're currently doing one task and then you're thinking about the other. Okay, so you're focusing on two things at once. Where's your focus on your feet, on how you're standing? So then sometimes when that happens, you might not even bring your foot out to reach for that toothbrush, and then you can fall. Okay, or something is behind you, and then you reach back and you come forward again, and let's say you crisscross your feet, you're gonna fall. So being well aware of where everything you need is. So, for shaving, brushing your teeth, combing your hair, whatever you use for your hair, making sure everything is in one place and one place only. You want to conserve your energy. Usually what happens after usually when we brush our teeth, what do we do right before that? We usually go to the bathroom. So you go to the bathroom and then you get up to go brush your teeth. You're using energy. You don't want to use any more energy that you need. Conserve your energy. The next thing is, sorry, oh, wait, sorry, Lenny. One thing is dressing yourself while you're seated. Okay. I know we all are used to putting on our pants as fast as possible, getting them on, but a safe way to do that is doing it while you're seated and using adaptive equipment if necessary. Learning the correct and safe use of grab bars, as I mentioned before. You want to know how to use them and how to sequence which one to grab first, followed by which one to grab next. Okay, a lot of people grab the second one first, and then they have no support. So it's okay to go step by step, even if it takes a few more seconds.
Next.
Yep, next. Sorry. All right. The next thing is avoiding falls during instrumental activities of daily living. So similar to ADLs, these are IADLs. These are more high level tasks. So if you have a hobby, that falls under this. Not only just hobbies, but also this falls under meal prepping, light housekeeping, doing laundry, more high level tasks that require more standing. All right. So, first and foremost, as I mentioned before, make sure to pace yourself and take seated breaks frequently. Okay. If you like to play shuffleboard, bring a chair if you have to. It's okay. While the other team goes, you can have a seat and wait for them to go. Don't worry about what they're going to say or what they might think. You need to take your break. Again, fatigue is one of the top reasons why people have falls. Okay. If you don't want to bring a chair right next to you, always be aware where there may be a chair or a bench close by and know where it is so you can take a break if necessary. Next is staying hydrated, always having water close to you. This is for my golfers, for my tennis players. Always have water close to you. Don't don't play tennis and leave the water by the fence. Leave it like right by the court, okay? You don't see that in the US Open, that's fine. You're not playing in the US Open. Leave your water close by, okay? Next is using the correct assistive device, especially when you're outdoors. If you're playing golf, and let's say you use a cane around the house and your PT cleared you or your OT cleared you to use your cane in a restaurant, you're not indoors, you're outdoors. Use a walker, okay? It's more stable. You're gonna be walking on grass. If you're playing golf, you might be going up hills. All right. So even if you don't really need it because you're using the cane all the time, use the walker for that activity if you want to if you want to stay playing your hobby. And lastly, always be aware of the positioning of your feet and posture. Meaning, if you're doing meal prepping, make sure your feet are shoulder width apart. What happens, even though you might have all your ingredients, condiments all in one place, you still have to turn to grab them. Make sure your feet are shoulder width apart to avoid crisscrossing. Okay, with Parkinson's, you are very vulnerable to crisscrossing your legs. It is the worst way to fall, besides falling forward. But it is a very bad way to fall. Your legs are tangled, and there's no way of you. You're literally falling down like a stick. So always be aware of your positioning and make sure your posture is right, especially with like housekeeping. If you're reaching down to clean something up, I know a lot of clients that have grandkids who leave toys lying around, and then the grandkid is, oh, where's my doll? And they want to get the doll for the grandkid. Make sure your posture is good when you're reaching for those items that are low to the ground.
Perfect. Awesome. All right, guys. So now we're gonna have a few minutes with questions, just for the Q&A. If you wanna make any questions, it's your time. Please just unmute yourself and let us know what you'd like to ask me or Moses. All right, hold on, Rolando. I know you're talking. Hold on. Let me try to unmute yourself. Try to unmute yourself, Rolando. Let me see here if I cannot unmute yourself here. Try to do yourself. There's a mic. Like click on.
Okay.
All right, now I can hear you.
Many of the falls happen during the night. And some people say, I know where I have to go at night to go to the restroom. But sometimes they are traveling and they are in a hotel or in another house. They need to leave a light in order to give them orientation.
Absolutely.
And the other one is that during the night or early in the morning that happen many falls, they have to try to sit down first in the bed with the legs outside the bed and count till 12. And after they count till 12, they got more chance to go to destination safely. Where this come from 12 comes from the Jewish religion. The first pray in the morning, it takes exactly 12 seconds. And from there, many doctors started telling everybody that they have to count till 12. That's all.
Yeah, so what he's saying, like, that count of 12 when you're coming, from bed to sit up just helps your blood to kind of like accommodate, especially because, once you're laying down and you're getting up, you're gonna have that quick change of blood circulation, just having that time, will help you not to avoid not to have falls, and also when you stand, wait for a couple seconds. His suggestion 12 seconds, so it's good. And then after that, you can move forward and do whatever you need to do. But it's very, very, very important, that pause, especially between transfers. Very good.
Okay.
To add to that, what he's saying about the 12 seconds. Another thing that we get with a lot of patients, both PT and OT, is, oh, but I don't have time. I have to go. I have to get going. And what I just want to say, just to put that out there, is always think, what's 12 seconds? It's better for you to take 12 seconds and prevent a fall rather than falling and taking months to recover from.
Sorry.
That's the time frame that a lot of people need to put in their heads, because believe me, 12 seconds is nothing, but to some people, like, I can't wait. So always keep that in mind. 12 seconds versus months of having to get better.
Perfect.
some guys used to tell, I rather got wet than get my head broken.
Oh, there you go. Absolutely.
Very good.
One's a quick fix, the other not so much.
Yes. Any other questions, guys? Please feel free. Just unmute yourself and go forward. We're here to hear you.
Honey,
Yes. Hi,
this is,
Joe.
this is Joe. You guys have just overwhelmed me with information, and the part that becomes important, at least in my mind, with what you've done is you've made us much more aware of activities that for all of our lives we have taken as completely mundane, regular activities that we don't have to think about doing.
Right.
Now, everything that we're doing, we have to think step by step completely, whether they're 12 steps or whatever other steps there are. And I want to thank you for that. We have to concentrate a lot more on what we're doing. That helps us not to fall also.
Absolutely. Being cautious is always a win-win, you know, safety first.
Yeah.
Anything else? I hear somebody. Let's see here. All good? All right. Let's wrap up. All right. Next topic. Put in the agenda, March 12th. All right. We're going to talk about cognition, brain. Very good topic, you know, and how to kind of like protect your brain and also, you know, with your mental health and maximize your cognition, you know, your executive functions, you know, in a way that you can, you're going to hear from us tips, you know, and takeaways, you know, regarding how to prevent, you know, some sort of like, you know, any declines in your cognition. All right. So it's going to be a very good topic, all right? And you cannot miss that, all right? And so, as you know, we have our Parkinson's exercise group class every Mondays at 4 p.m. for more high-level patients. And we also have online classes Tuesdays 11 a.m. for standing, and then Fridays 2 p.m. for seated exercise. Feel free to Zoom meet us as Zoom. So the same link that you use for the webinars, you can use for this one. And then we have also our support groups for caretakers, you know, for them to get some help as well and some empowerment to keep their jobs and tasks. All right. All right, if you need to contact us, this is our email, contact@drphysiotw.com, or phone number. We are located in Fort Lauderdale and Delray, so we have two clinics. Feel free to reach us there, meet us there if you need it. All right, any of our services. So we offer physical therapy, occupational therapy, speech. And if you need anything else regarding, you know, we offer that exercise, class, and those things for you. All right. All right, guys, very good. Keep balancing yourselves really properly. Don't be you know, too much on your adventure side. Maybe you have to retire that, but all right. In risk side, but be always cautious and, you know, aware of that, you know, your stability and safety comes in first place. All right.
Thank
Thank you.
My pleasure.
Thank you.
Thank you. Thank you.
Bye, guys.
Very
Roses,
good.
thank you so much.
Thank you.
Okay.
Bye.
Thank you.
You guys take care. Have
You
a good,
too.
good afternoon. God bless you all. Bye-bye.
Bye, guys.
Bye-bye.
All right, later, Lenny.
All right, my friend. Thank you.
Welcome.
Stop here.